You go to bed, turn off the lights, and close your eyes. But sleep just doesn't come. Hours pass, your mind keeps running, and the next day you feel tired, unfocused, and drained. If this happens occasionally, it's normal. But when it becomes frequent, it turns into a condition called insomnia, where the body struggles to get the rest it needs. So what exactly is insomnia? Insomnia is a sleep disorder where a person has difficulty falling asleep, staying asleep, or waking up too early and not being able to go back to sleep. It can affect both the quality and duration of sleep, leading to daytime fatigue, irritability, and difficulty concentrating. Sleep is not just rest, it is an essential process where the body and brain recover, repair, and reset. During sleep, the brain processes information, the body repairs tissues, and important hormones are regulated. When sleep is disrupted, these processes are affected. Insomnia can be caused by several factors. One major cause is stress and anxiety, which can keep the brain active and prevent relaxation. Lifestyle habits such as excessive screen time, irregular sleep schedules, and high caffeine intake can also interfere with sleep. In some cases, insomnia may be linked to underlying health conditions or medications. At the biological level, insomnia is often connected to the brain's sleep-wake cycle, also known as the circadian rhythm. This cycle is controlled by a part of the brain that responds to light and darkness. Hormones like melatonin help signal when it's time to sleep. When this system is disrupted, the body struggles to maintain a regular sleep pattern. Neurotransmitters also play a role. Chemicals like GABA help calm the brain and promote sleep, while others keep the brain alert. An imbalance in these chemicals can make it harder to fall asleep or stay asleep. Insomnia can be short-term or long-term. Short-term insomnia may occur due to temporary stress or changes in routine. Chronic insomnia, on the other hand, lasts for weeks or months and can significantly affect overall health. If left untreated, insomnia can impact both mental and physical health. It can reduce concentration, weaken the immune system, and increase the risk of conditions such as anxiety, depression, and heart disease. The understanding of sleep and insomnia has evolved over time as scientists studied brain activity during sleep and the factors that influence it. Treatment for insomnia often includes lifestyle changes, behavioral therapy, and sometimes medication. Improving sleep habits, such as maintaining a regular sleep schedule, reducing screen time before bed, and creating a comfortable sleep environment, can make a significant difference. Today, modern technology is helping improve sleep health. Artificial intelligence and machine learning are being used in sleep tracking devices to monitor sleep patterns, identify disturbances, and provide personalized recommendations. These tools can help individuals understand their sleep habits and make adjustments for better rest. Sleep is essential for the body to function properly, and insomnia disrupts this vital process. Understanding what causes insomnia and how it affects the body is the first step toward improving sleep and overall health.